Hi, I'm Dr. Shah from the Moffitt Cancer Center in Tampa, Florida. I'm an associate professor in the Department of Malignant Hematology, where I focus on the treatment of mantle cell lymphoma. The prognosis for patients with relapsed refractory mantle cell lymphoma is still somewhat of a challenge, especially when we talk about advanced relapses, right? Where we're saying that they've relapsed now after 2, 3, 4, 5 lines of therapy. Nice review by Anita Kumar and her colleagues at Memorial Sloan Kettering was performed, and they could show what we've all experienced, I think, in practice, which is this notion of diminishing returns with each subsequent line of therapy. And so if we get, call it 5 years from the first line, we're going to get 2.5 years from the next line, 1 year from the next line, and 6 months, so on and so forth. And essentially what we're talking about when we say specifically, let's fast forward now to the third line and beyond setting, we're talking about a median PFS of somewhere around 3 to 6 months for, again, diminishing with each line. And when we talk about survival, it's also dropping off dramatically. We're talking about an overall survival once we get into that third line setting of median of around 2 years. When we talk about fourth line now, it's something more along the lines of about a year, and so on and so forth. And so we really are running into considerable difficulties when we talk about the treatment of multiply relapsed and refractory mantle. Kite/Gilead Pharmaceuticals submitted to the FDA a request for CAR T-cell therapy approval in mantle cell lymphoma. Now, there's a couple of things to know about this particular CAR T. It's made a little bit differently. It's not called Carta as the product that's currently approved for diffuse large B-cell is called. This one is currently going by the name KTEX19. I'm not sure what the official brand name will be yet. KTEX19 is unique in that there's a separation step involved before the CAR T cells are manufactured. So normally, when we talk about treating a patient with diffuse large B-cell lymphoma, we just collect, the T cells, and if there's other cells in the product, that's fine. They can go into the manufacturing, no big deal. When we talk about KTEX19, now we're actually very purposefully separating out the T cells from the rest of the product before manufacture. And so that process of isolating the CD4s and the CD8 T cells does just make the product unique. And again, that change in manufacturing does require a different moniker for the product. In terms of the priority review, when Kite Gilead launched the trial, they had already been working with the FDA. So, this is something where really the process is dating back to around 2016 or so, or somewhere thereabouts when the trial was first getting off the ground, where they had begun conversations with FDA to ask what would it take to commercialize this product. And so I think what we're seeing in terms of the the BLA, and the rapid sort of turnaround for that BLA is more a reflection of all things that happened beforehand. Now, certainly the data we've seen to date are very encouraging, and I think also support that priority review. We're expecting an answer in August. I'm keeping my fingers crossed. We certainly, as I alluded to earlier, need new therapies for higher risk variants of mantle cell lymphoma, and the data that we're seeing coming out of this particular trial suggests this could be a very powerful adjunct.